Antifungal athlete's foot, DPH 2053, sterile pharmaceutics. The lecture contains introduction to athlete's foot, causes, symptoms, treatments, preventions, and complications. Introduction: athlete's foot. Athlete's foot is a fungal infection that affects the upper layer of the skin of the foot, especially when it is warm, moist, and irritated, also known as tinea pedis, and ringworms on the foot. The fungus that causes athlete's foot is called trichophyton and is commonly found on floors and clothing. Tinea pedis can be a chronic infection that recurs frequently. It only infects the skin if the conditions are right. It requires a warm and moist environment, for example, the inside of a shoe. Because of this, only some people who regularly walk out barefoot are affected. Athlete's foot most commonly develop between the toes. It usually causes burning, stinging, redness, and itching. It also causes flaking of the skin in some people. It is the most common type of fungal infections. Although it is contagious, athlete's foot can usually be treated with over-the-counter medications. However, individuals with weakened immune system or diabetes should see a doctor as soon as athlete's foot develops. Causes: the athlete's foot fungus, trichophyton, and a dermatophyton, related to other fungi that cause infection in human skins, hair, and nails. Their reproduction is limited. However, under damp and warm conditions, they multiply rapidly. Tight shoes are more likely to trigger athlete's foot because they squeeze the toes together, creating ideal conditions for the fungus to thrive. Plastic shoes are more likely to bring on athlete's foot than those made of other materials such as leather or canvas. If socks are damp and the feet are warm, there is a greater risk of developing athlete's foot. Athlete's foot can be spread through direct and indirect contacts. Direct skin-to-skin contact may occur when an unaffected person touches the infected area of someone with athlete's foot. Indirect contact, in which the fungi can infect people via contaminated surface, clothing, socks, shoes, bed sheets, and towels. Signs and symptoms: itching and burning, dry skin, scaling, inflammation. Blistering leads to cracking of the skin. Example of signs and symptoms: the sole and the side of the foot may develop scaling patterns. Athlete's foot is served and causes open sores in the skin, make it more vulnerable to bacterials. If left untreated, can risk infection spreads from toe to toe. Rashes may develop the side and the bottom of the feet. Rare cases, athlete's foot can spread to the hand. People who do not wash after touching the affected area on foot are at high risk. Treatments: the use of anti-fungal soaps is for mild skin rashes and prevents fungal-based infections. Antifungal creams treat fungal infection and which are applied directly to the skin. And antifungal tablets. Patients at high risk for fungal infections and critically ill patients suffer from invasive fungal infections. Over-the-counter medications: meconazole, terbinafine, critmazole, butanafine, and toinaftate. Preventions: wash feet daily, dry feet well, including between the toes. Avoid walking barefooted. Wear shoes in the locker rooms or common shower areas. Use powder to reduce perspiration. Wear well-fitted ventilated shoes. Alternate your shoes to allow for air drying. Wear socks that keep your feet dry. Change shoes and socks at least once daily. Do not share shoes or towel with others. Complications: fungal nail infections, Untreated athlete's foot can spread to the toenails in a condition known as ochonomycosis. The nail becomes thick, opaque, whitish, and crumbly. Secondary bacterial infections. If this develops, the foot may become painful, hot, and swollen. Infected lymph system. The infected can sometimes spread to the lymph system. Lymphangitis is an infection of the lymph vessels, and lymphadenitis is infection of the lymph nodes. Cellulitis. This is a bacterial infection deep in the skin. Fat and soft tissues may be affected. Untreated cellulitis can lead to serious complications such as spectemia, blood poisoning, or bone infections. Allergies. Some people are allergic to fungus that cause athlete's foot. This can cause blistering around their hands and feet. This is the end of lecture. Thank you for listening.